Thank you, Mr. Chairman. House Bill 818 deals with the Rural Fire Truck Matching Assistance Program. In Section 1, it amends Section 1723-1 to remove the provision that limits eligibility for participation in the Rural Fire Truck Matching Assistance Program to only 8 rounds. And what this does, it's very simple. It doesn't hurt any county in any of the rounds, but what it does do, it helps the smaller counties that can't get to those rounds. And that's why the elimination of round 8 is. In Section 2 amends Section 25-15-409 to allow the Mississippi Insurance Department to retain the TPA to administer a first responder cancer program. And it allows the insurance commissioner to pay from the TPA from the trust fund. This was passed a few years back for first responders that were getting cancer. And this is going to allow the insurance commissioner to be able to provide those funds. Section 3 amends Section 25-15-411 to remove the requirement of the insurance commissioner to notify the House and Senate insurance chair before disbursement of monies from the trust fund. It just takes out some red tape to allow the insurance commissioner to do his job. Section 4 brings forward Code Section 83-5-72 for possible amendment. This assessment that currently goes to the general fund of $750,000 could be amended to monies elsewhere. This is a section we're going to look at when it goes to the floor. We may amend this, but at this time, we're going to keep it in there. Sections 5 and 6 amends Section 83-1-37 and 83-1-39 to increase the credit to the county and municipal fire rebate and funds. If there's any questions, I'll be happy to answer them. If not, Mr. Chairman, title sufficient do pass.
Seeing no questions, motion's title sufficient do pass. All in favor say aye. Any opposed? That bill will be reported. House Bill 819. This is a bill that the Commissioner of Insurance's office is promoting. It's got 2 or 3 sections to it. Commissioner Cheney, would you be so kind to address us at the podium and explain the bill, please?
Thank you, Mr. Chairman. House Bill 819 has 4 parts to it. The first section is on line 99 through 100. It's a pre-licensing requirement. We just added life insurance to the program. It's already exempt. It's not a big deal. Saves a lot of money for the consumer. They can study on their own instead of having to go and sit in a class for a week. Line 139 through 142 is public adjusters. And I'm going to ask Commissioner Browning to explain the public adjusters.
You recognize?
With tag teaming you double today.
Thank you.
David.
Thank you. What Section 4 does is just provide some clarification regarding public adjusters payment, establishes additional ethical standards for public adjusters, clarifies the compensation a public adjuster may receive on a claim. Currently, a public adjuster may receive a payment of 10% of the total claim settlement, which includes monies that a policyholder may have received prior to retaining the public adjuster. This language will clarify that the public adjuster may receive 10% of the amount of the settlement the public adjuster actually assisted the policyholder in recovering. And it establishes some new standards to ensure that a public adjuster does not have a conflict of interest adjusting a claim, prohibits a public adjuster from having a financial interest in any business that may be in connection with the salvage or repair of the claim, and ensures that a public adjuster shall not participate in the reconstruction, repair, or restoration of damaged property he is adjusting. And that's the explanation of that section.
So most of you know that after the tornadoes that hit back in March of last year in Rolling Fork, we've had some real problems in trying to get adjusters to do the right thing. And this clarifies, as an example, many states have just outlawed them, like Arkansas, but we feel like they fill a need, especially if you have a catastrophic event on the Gulf Coast. you've got to have public adjusters available. So this is just tightening up, giving them some guidelines so they don't get any interest, have kickbacks, anything that's illegal. And basically tries to level the playing field. The third section of the bill is line 156 to 158. And that all adds the same thing to the public adjuster bill. And then the last part of the bill is in section 5. It deals with the risk pool. It will allow the risk pool to develop a software package where someone that buys a Medicare plan Part C, whether it's a Medicare Advantage plan or regular care, a Medicare Part C, they can enter their home address, where they live, what hospital or doctor they go to, the drugs that they're taking to see which plans will fit them. And here's the problem. A lot of the Medicare Advantage plans that we have today sold in this state will hook you in, promising you a free credit card, a free gift, free everything, and then you sign up and you suddenly find out your doctor's not in the network, the drugs that you're taking are not covered. And once you do this, you can't go back to regular Part C unless you're rated. And most of these people get rated. And when they do, the rates that they have to pay for a bona fide Part B plan is usually twice as high as they would normally pay. So what looks free is not really good. So that's basically the bill within itself. I'll be glad to address any questions.
Any questions? Could any have a motion?
Yes, sir. Title sufficient to pass.
Motion is title sufficient to pass House Bill 819. All in favor, say aye.
Aye.
Are there any opposed? Bill will be reported. Thank you. House Bill 871. It's a long bill, but the only change to the gist of the legislation is language is added on page 305, on lines 305 to 307 that clarify that the practice of dentistry is not included in the definition of a healthcare provider. This will allow dentists to accept dental care plans as well as gives them the option to also receive payment from their patient. Any questions on this bill? I know many of you had many discussions with your dentist back home on this. Are there any questions? All right, Senator Whaley moves title sufficient to pass House Bill 871. All in favor, say aye.
Aye.
Are there any opposed? Bill will be reported. All right, Senator Delano, our coast expert, we have House Bill 888. Would you please explain that bill?
Thank you, Mr. Chairman. Ladies and gentlemen of the committee, this bill really, we can break this down into two separate types of, or two separate issues that are addressed here. It deals with mitigation and trying to help homeowners reduce their risk to windstorm loss or just disaster loss. The first part of the bill deals with catastrophic savings accounts and expands a little bit of the language for the catastrophic savings accounts for activities that you can use those funds for. That starts on line 63 and runs over to line 95. Again, this adds some language. This is something that we've already had in the state for quite some time. Not that many people have used it, unfortunately, but it is something that has been helpful for some homeowners. This expands it a little bit more and adds language for tornado safe rooms. So this will actually help quite a few people in the north part of the state away from the coast that are still subject to some of these types of windstorm losses. It talks about some additional protections for like window openings, reinforcements of roof to wall and floor to wall connections for seismic activities. So it covers a very broad range of catastrophic losses that homeowners will be able to try to mitigate their homes for. The second part of this bill deals with an insurance or with a mitigation program. And this is more for retrofitting. And this is still a work in progress. I'm going to ask the committee to amend this to put a reverse repealer in it so that we can continue to work on it. But what we're wanting to do is to help the Department of Insurance come up with a windstorm mitigation program that would be managed. We're trying to still come up with some money. This bill is double referred to appropriations. We're trying to come up with money so that we can seed this to help homeowners across the state. It will not be limited to just the coastal counties. Again, we're trying to address the issues with tornadic activities that we've seen throughout the rest of the state. So at this time, Mr. Chairman, I would like to add an amendment for a reverse repealer to this bill.
Okay, the motion is that a reverse repeal will be added in the bill. All in favor, say aye.
Aye.
Any opposed to that?
And Mr. Chairman, I'll yield for any questions at this time.
Okay, any questions, committee members?
If there are no questions, I'll move for title sufficient do pass, strike all.
All right, you heard the motion. All in favor, say aye.
Aye.
Any opposed? Bill will be reported. House Bill 1079, Senator Suber.
Thank you, Mr. Chairman. This bill addresses the filing of clean claims by a medical provider. The problem we're having is some of the medical providers are submitting claims to the healthcare providers, or excuse me, to the insurance companies, health insurance company. And the companies are paying some of the claims that are considered a clean claim. But if there's a claim that there's any kind of issue, that they're not necessarily letting the medical provider know. And so we can go on for long periods of time without having any idea of why these aren't being paid. So what this bill does will address this issue. It will require the insurer upon a request to provide any documentation to show why this claim is not being paid and what it needs to become a clean claim. An additional part of this will also give the commissioner the ability to adopt any rules and regulations. That is already in this bill, but it only addresses one section, and so this will allow him to for the whole code section. I'd be happy to answer any questions.
Are there any questions?
Title sufficient do pass, and Mr. Chairman.
Okay, motion is title sufficient to pass. All in favor, say aye. Be opposed? That will be reported. 1079 will be reported. House Bill 1213, Senator Blackman, you're recognized.
Thank you, Mr. Chairman. What this bill does is it would prohibit insurers that offer life insurance, disability insurance, or long-term care insurance policies from declining or limiting the policy solely because the insured or the potential insured was a living organ donor. And they can't preclude someone who's already insured from being a living organ donor as a condition for keeping their coverage. And it would allow the Department of Insurance to adopt rules to effectuate the same. And while kidneys are the most common, you can also donate parts of your liver, you can do skin grafts, bone marrow transfers, or parts of your lung. And that's a simple explanation of the bill. Be happy to take any questions.
Are there any questions? Motion, Senator Blackman.
Title sufficient do pass.
Motion is title sufficient to pass. All in favor, say aye.
Aye.
Any opposed? Bill will be reported. Thank you. Okay, Commissioner Cheney, House Bill 1410. This is one we dealt with last year, and we have it before us again this year.
Thank you, Mr. Chairman. Mr. Chairman, I have a handout if someone would like one, but to give you the examples. So, while they've been passed out, I'll give you a brief explanation of 14. $1410 simply says that if a policyholder paid a premium in another state and bought a policy in another state, or his employer did, they live in Mississippi, that policy must be administered at the rates that policyholder paid for within the state of where the policy was issued. In other words, if you were entitled to certain drugs and medical benefits, say in the state of Alabama, that you had a policy you had purchased there, those benefits would apply in Mississippi. We've given you an example that we passed out. This is actually two law firms here in Jackson. One of them has insurance out of Tennessee, and the other one has insurance out of the state of Alabama, same carrier. You will notice the difference between the reimbursement rates to the provider in three different cases in example 1, 2, and 3. And at the bottom on example 1, there's a $10,000 difference between the reimbursement rate. The Alabama plan said it was approved. The Mississippi TPA said it was not. I think we have worked most of that out yesterday. to be certain. Alabama said they would make sure the provider was paid the extra $10,000 because it was paid for by the policyholder. That's, Bill, any questions?
Questions? All seeing none. Senator Delano.
Mr. Chairman, I wasn't on, well, I don't remember the reason, but is this the bill that the governor vetoed?
My understanding, it was part of a bill.
It was part of a bill that the governor vetoed. We worked with the governor's office. Those sections were taken out. I did add the exemption of ERISA plans and self-funded plans, just to make it very clear that this does not apply to them. And the governor's office has looked at it. They're happy with it. We've run it around other states to see what other commissioners think. They're all happy with it. So it's a pretty simple piece of legislation.
Any other questions?
Yeah, so if you don't mind, Mr.
Sure, I'm
Chairman.
sorry. ahead.
How many, is this something that Alabama requires of the state of Mississippi, or for policies that are written in the state of Mississippi?
If you have an exchange agreement, basically, yes.
Okay, and do other states have laws that are similar to this?
They do.
Okay, so I'm trying to wrap my head around, you know how hard at it I am, but I'm trying to wrap my head around how we're going to enforce, or how we're going to extend your regulatory authority to policies that are written in other states.
The regulatory authority applies to this state only. Then if that policy is administered in this state, then we have regulatory authority over that policy. This is not a mandate. This is just enforcing the contract.
Okay, but you're talking about in this example, you're talking about the patient lives in Mississippi, but it works in Tennessee, correct? Is that right?
No, I'm
So-
talking about the patient lives in Mississippi, but the policy is written in Tennessee
Through an employer,
through their employer.
right? And the services are provided in Mississippi,
That's correct.
and you want to hold the policy that was written in Tennessee, you want to hold them responsible for paying what Mississippi would require in a reimbursement? Is that
What
right?
We're requiring that if a policyholder in Tennessee paid a premium to an insurance company for benefits, whether it be medical or drug benefits, that they're entitled to those same benefits in Mississippi.
Okay, maybe I'm misunderstanding this, Mr. Chairman, but I'll yield at this time.
Okay. Any other questions?
I've got one.
Lennon?
Mr. Commissioner, I know in the Memphis area, there's a couple of insurance companies with the same name, except two differences. One says Memphis and one says Tennessee. And each one of those have different billing rates. For example, and I'm not picking on, there's a Blue Cross Blue Shield of Memphis. There's a Blue Cross Blue Shield of Tennessee. Is that correct?
That's correct.
And they both have different rates that they go by. They charge different rates and they also pay different rates. And all you're trying to do is solidify what Mississippi gets paid. Is that correct?
That's correct. A good example would be that the last example, one at the bottom of the page we handed out, if you lived in, let's say that this was in DeSoto County, and you went to the doctor in DeSoto County, say Baptist Hospital, and you had a procedure done. This is a revitalization drug for someone that's pretty sick, and you have to have it immediately. That doctor would have been paid $10,000 less than if he had driven 13 miles up the road and gone to the hospital in Memphis.
And either one of those companies that are in Tennessee could also write a company on the coast. Is that correct?
Correct.
So those rates you're trying to get done are for citizens of Mississippi, not for the insurers of Tennessee.
What we're trying to do is to protect that policyholder that paid a premium for a benefit and make sure they can get that benefit in Mississippi if they paid the premium or the employer did.
Thank you, sir.
Any other questions? Is there a motion?
Title sufficient to pass.
All right, the motion is title sufficient to pass. House Bill 1410, all in favor, say aye. Any opposed? The bill will be reported. Thank you, Commissioner. All right, House Bill 1489, Senator McClendon.
Thank you, Mr. Chairman. When this bill started, it started out as two bills. The first bill was basically a transport bill. And what the bill did was trying to get a fair paid for ambulances that are transporting people, doing life support, that kind of thing. The other bill that we had was a bill that the ambulances would go to a person's home, treat that person. I'll give an example of, let's say a person had OD'd and the ambulance shows up. Ambulance drivers, the first responders are there. They Narcan the person, administer first aid, get the person back to life. This person wakes up and says, oh my God, I've done drugs. If I go to the hospital, they're going to arrest me. So no, I don't want to transport. That ambulance company, whether it be a municipality or the company, could collect $0 for that because they weren't transported. Now, there were some issues that with these two bills, could they be put together? On the House side, we've checked and it appears that yes, both of these bills can be put together. Now, I want to be known in this committee that I am a staunch advocate for ambulance and first responders. I was on the board, City of Hernando, for 8 years. For my first 3 years on Hernando, we had one ambulance. That was of a town that had 17,500 people. We had one ambulance in that city. I was one of the people that screamed, cried, and threw a fit that we needed, take dollars and put it to our people to have another responder. Now, we're blessed where I live because we have 4 municipalities with different ambulance services. We also have a county that each volunteer fire department has an ambulance at each one of those volunteer firemen. And we reciprocate, whether we're responding to somebody on the interstate that crashes, that lives in New York and Florida, that doesn't pay any kind of tax. One of those ambulances is going to go respond. And when that happens, if it's a Hernando ambulance is responding, here Hernando's down an ambulance. So who's going to come in? Either the county, Horn Lake, or South Haven. If it's on the east side, vice versa. It'll be one of the counties or South Haven go respond for Olive Branch. So I wanted to clear that up. First of all, we're not on the insurance company side. We're not on the ambulance side. We're trying to get the best for these people. We want ambulances, counties, and ambulance services to be able to pay for services. That's our goal. We also want to have a fair price that these insurance companies paid. We don't want to rake them over the coals. Now, this is a work in progress that we're doing. So I'm going to explain the bill as we've got it going. And it also has a reverse repealer in it. So what we've done in House Bill 1489, we took 1629 language, we've added all into House Bill 1489. We added health plan, benefit plan on line 96 and 97. If you turn to 96 and 97, the bill said the minimum allowed reimbursement rate under any policy of accident and sickness insurance as defined in section 83-9-1, we've added or any health plan as defined 89-9-6.3 to a participating ambulance service. We also added, we changed the reimbursement level, and this is where we're at issue right here. We want to have a fair market price. As this states 100% of the Medicare reimbursement allowed by Medicare. Services originating in a rural area, plus an ambulance response fee and payment for the ground mileage incurred by the ambulance service provider. What's at issue is Medicaid pays one rate and then they won't pay for gas. But Medicare will pay something else, which is one of the issues I have with our Medicaid bill, but that's something totally different. So that's one of the things we're going to have to look at as this goes back to conference. Also, if you'll look in lines 105, line 125 to 126 in section 4, this act shall take effect and be enforced after July 1st, 2024, and shall stand repealed on June 30th, 2024. So what we want to do is have a reverse repealer in this and then carry this, work with the ambulance companies, make sure this municipality of DeSoto County or Warren County, which are the only two counties that have their own ambulance, make sure their rates will not be hurt and we have a uniform fee pay in Mississippi. And Mr. Chairman, with that, I'll be happy to answer any questions.
Senator yields for questions. Do you have any questions? Senator Delano, you recognized.
I think, what did the House have as far as the Medicaid or the Medicare reimbursement rate?
They had 325%. Now, what we want to check is to make sure that's not gouging anyone. We also want to make sure that this 100% is not way too low. But then you throw in Medicaid where they won't pay mileage. So that's the three different animals that we're dealing with here. So I'm not opposed to going back to the 325, but I just want to make sure that everybody's on a level playing field here, and also that our constituents get the ambulance care that they deserve so that taxes won't go up to have to pay for these absorbent rates.
Yeah, I understand that part of it. When I looked, I had some involvement with this bill, I think last year or some other time, because it was an issue on the coast and I was trying to help. Even my hospitals were telling me, yeah, this isn't right. Something's got to be fixed with this. I asked what other states were doing around us or what was reasonable with respect to the reimbursement rate, because I'm used to always looking at things through Medicaid versus Medicare. And so I didn't understand what that looked like.
Right.
But the bill says that it's 100% reimbursement by Medicare plus an ambulance response fee, which I don't know what that amount equals to, or if that's something that's negotiated within the counties or within the areas of the service, plus a ground mileage incurred. I don't know if there's what that fee looks like either, but it looked like that was something that was similar, or at least those two numbers were something that were based off of something that you could look up that wasn't arbitrary. And then the reimbursement rate was generally much higher than 100% because of the type of service that it was provided, whereas Medicare was intended for it to be in a static building location and that. But as you move forward with this, I would think that the 100% is going to be significantly lower than what we would see. But I understand what you're trying to do, Mr. Chairman.
It will be, and we wanted to be an attention getter to make sure that we all come to the table on this. And I've got the Hernando rates, which are the DeSoto County rates, and ground mileage, they've got $33. Basic life support, $1,600. and advanced 1925. So yes, we are going to work with the House. We got this, we didn't see it on the Senate side. It came from the House. We just want to make sure that we get this right for our ambulance providers
Thank you, Mr. Chairman.
as well as our municipalities.
Any other questions? Senator Whaley?
Thank you, Mr. Chairman. Thank you, Senator, for taking my questions. I had been watching these bills come through the system, and I was surprised today when I saw that they had been merged into one. And a lot of my questions goes back to that 100%, and especially the term when you say rural area, because that is where I'm from, and I see a lot of things that we're not blessed to have that DeSoto County has. And I'm not
Yes, sir.
saying that I'm jealous of that, but I don't want to see a situation where we potentially harm every other county that is rural around and in the state
Correct.
at the fact of we're worried about solely DeSoto County. So I want to know that that's not the case. Is that?
That is not the case because believe it or not, there are still rural areas of DeSoto County. If you go to
Well,
Cockram Alphabah out there, it's a long way to Olive Branch and Hernando.
well, I understand that, but as opposed to you said, you made the mention that every volunteer fire department has an ambulance
In DeSoto
in
County.
DeSoto County as well as the municipalities having it. County that I live in, such as Marshall, we're lucky to have two at any given time. And that's a problem in a county that is more than twice the size of that of DeSoto County.
Yes,
So,
sir, it is.
coming from a long way means a lot to me and to my constituents. And you mentioned, changing this from 325% to 100% as an attention getter. Well, it's definitely gotten my attention. I don't understand why, if we're going to have the reverse repealer and we're working and we're trying to take care of the ambulance service and the constituents, why do we need such an attention getter to go from 325 to 100?
Well, the issue is the 325% number that came up. We want to make sure that is applicable with all the insurance companies and what they're paying and what they're willing to pay along with the Medicare.
Well, is
As
that
well as
not the
Medicaid.
purpose of the reverse repealer, to send this to conference to make sure that we have the position?
Absolutely, yes, sir.
Then why are we changing that from 325 to 100 when we know that this will go to conference and we will get those facts as this bill goes through the process?
We wanted to make sure that nobody was hurt, because you also have insurance companies in this too. And we don't want rates to go up because of this.
Well, I haven't heard from any insurance company that's opposing this. I haven't heard from anybody, but I have heard from my locals and I have heard from the ambulance companies, and everyone that I have talked to so far has been in support of this, and I've heard no negative, and I'm more than willing to talk to anyone that's negative, but the attention getter has gotten my attention, and
Right.
I'm not in love with it. I'm just going to be honest with you. Would y'all be opposed to an amendment to change that 100% rate back to 325, even though it still does have the reverse repealer, and allow this to work through the system? Mr. Chairman,
That's anyone's prerogative to offer an amendment.
I'd like to offer an amendment at the proper time, Mr. Chairman.
State your amendment, please.
I'd like to change by line 105, I believe is what it was. The 100% back to the 325% mark that we were. That was in the original language.
Okay. Any questions on the amendment? The strike all document? Man, you have a question?
Does the senator have a position on it? Is there,
I really want to investigate more where the 325 came from.
Can I, Mr. Chairman, could I speak to that?
Certainly, certainly.
My amendment, we have stated, and it's clear that this has a reverse repealer and this will be going to conference, and we'll have time to get the information and get the facts as to whether or not this is good or bad. Simply put, the original language was 325. We have nothing to say that that is bad or good. 100% is significantly lower. I'm not a math expert, but I'd say about 225% lower. So it has a reverse repealer. It's going to conference.
Would you? be
I would
willing-
ask that we vote for the amendment.
Look, can I speak on the amendment? Would you be willing to split the difference on that from 100 to 325 to, say,
I mean, Mr. Chairman, Mr. Vice
we're
Chairman,
cutting, we're
you're,
cutting hairs, and
you-
I agree.
y'all are more than willing to offer the amendment however you will. My amendment's for 325. That's what I want. But the committee, as always, can do what the committee wants.
Okay, any other questions on the amendment? Okay, the amendment is to change on line 105, the 100% payment to 325%. All in favor, say aye. Any opposed?
Oh,
Okay, the amendment will be adopted. Now we're back on the strike all. Senator,
any more questions?
strike all as amended.
If not, title sufficient, do pass, strike all.
Okay, you hear the motion. All in favor, say aye. Any opposed? Bill will be reported. We have a motion, we rise and report.
Rise and report.
No, no, no.